My name is Rylee Jernigan, and I'll be giving an informative speech about the 3 most common injuries in volleyball. I have emailed you a picture of my driver's license. The 3 topics that I'll be talking about is the shoulder injury, ankle, and knee injury. So specifically in the shoulder, we have the rotator cuff tear. This is a picture of this shoulder, and this happens when the tissues that connect the muscles to the bones, when it tears. It takes 4 to 6 months to come back from a surgery with this, and it very rarely heals on its own. It requires lots of physical therapy, and it takes you out of your sport for the season. You have to make sure when you do go back to your sport that you fully warm up. And if your shoulder starts having any types of pain, make sure that you stop playing, because that increases your chance of re-tearing. Some of the movements that you can do to prevent this injury would be the internal and external rotation. I got this from childrenscolorado.org. So if you get a band and you put a knot in it and put it at the end in the door, and take it and pull it outwards, and then opposite way for internal. The second injury I'll be talking about is with the knee. It is the ACL injury, ACL tear. It's when you do a lot of short cutting maneuvers, or if you jump and land wrong and your knee comes in and pops. That's a good way to signal that you have torn something. It is right in the middle of the knee, and it is the ligament that prevents the bone from sliding, the shin bone from sliding in front of the thigh bone. Some symptoms would be, like I said, popping, swelling, instability. Again, you almost always need surgery for this injury. I got that from midjerseyortho.com. Some of the exercises that you could do to prevent this and strengthen your knees, that's why you have a lot of ACL injuries, is because the knees are weak. You're more liable to have an injury if you have a V-shaped knee, like an X. So you could tie this around your knees and then pull your knees apart, squat, and walk forwards, sideways, or backwards. I got that from orthoinfo.org. My last injury would be with the ankle. This is when you land wrong, you twist it, you land on somebody else's foot, which causes you to turn it inwards, but most of your sprains come from turning outwards of your foot. To prevent this, you can wear braces. Lots of volleyball players, especially if you're in the front row, you're gonna wear an ankle brace. A lot of balancing exercises, just getting on one foot, closing your eyes, staying balanced for however long. And then you can do some isometric exercises. So you can take this, wrap it around your foot and like a gas pedal, and then have someone hold it this way, and you pull it backwards, and then sideways and inwards. This is a picture of it, and like I said, it's mainly that L shape that you see with the sprain. This could lead to any type of tears, but normally it's not going to. It'd have to be a pretty bad sprain for it to be a tear. With that being said, you don't need surgery for it. You can do lots of self-care, just icing. Everybody knows the rest, ice, elevate. I got that from mountsinai.org. Some of the symptoms you will have, though, with this would be pain, lots of pain. You will definitely have a lot of swelling, bruising. You're going to have little to no range of motion. It'll have a little popping sensation. And the reason I have given this speech is because I have personally had to deal with an injury with my shoulder when I've been playing for the past 6 years. I had an overuse injury to my shoulder, which led to a rotator cuff tear. I had to do lots of physical therapy before and after the surgery, and ultimately I got back into it. I had rotator cuff tear, labrum tear, slap tear. There's so many different things that can tear when you're playing in a sport. That's why prevention is very important, why exercising is very important. And that is my speech. Oh, I got it.